Hi there. Is that Merlene?
Yes, this is Merlene. Sorry for being a bit late.
Oh, you are just fine. This is Betsy, and I see that Philip and Francis are online as well. And we did have a request to record our session so
Yes,
that we can share it with everyone who wasn't able to make it. I know there were some conflicts.
yes.
So I just wanted to let you all know that we can keep this informal, and I'd be happy to field any of your questions about PolicyMap and about the data that's here. And I really wanted to show you as well the healthcare report. So I'm not sure if you all get a chance to take advantage of your PolicyMap subscription, and if it's a resource that you are somewhat familiar with and perhaps you need to learn more about. So I
Yes, we are familiar with it. When I received that email about the premium policy map premium, and there were some additional features. So basically, I think that's what we need to know.
Okay. Well, I did want to show you, and I'll go into your actual website as well. But if you ever have questions about our data and what data is there, there is a
Hmm.
link on our main website. And from this link, you do have the ability to go in and download the complete matrix. If you have questions about how far back the data goes, whether or not it's subscription only, whether or not it is data that you can download, this is all here. And it will tell you, is it available at the state, county, census tract level, or even down to the block group here on this main page. But you can download the entire matrix for your reference, or it's always up here on our website. And our data team is in the process of adding a radio button here just for this premium data. So I wanted to give you a heads up about that and what's there. The other thing is that you should know that we have some resources for our university libraries. And for any of our subscribers. So if you ever have questions about how to create a 3-layer map, or how to download our data, how to upload your own data, that's all right here. We do free public trainings twice per week. And then we also have these curriculum resources. So whether you might be a subject specialist for the College of Health Sciences, or for the social sciences, or for social work or urban planning, there's lots of good stuff here. So there's some sample exercises, there's some videos, and then we have assignments and papers and sample syllabi that you can reference from within here and see exactly how other people are using PolicyMap, and take a look at some of the syllabi as well. So right now, obviously, one of our main focuses is in the area of public health, and we're really trying to do everything we can to support our universities during this crisis. So you're going to find that we have a good deal of data within the area of public health. And also take a look at our blog, and hopefully you all receive our blog and our newsletters, because we're constantly adding some data around that to support anybody who needs data to back up how to figure out what's going on in their community related to vulnerable populations, or access to the internet, or access to federally qualified healthcare centers. And there's some really good blogs here and some examples. And we did just release this public-facing COVID-19 quick map that is free for everyone and can be embedded into your own sites, where we have some really interesting maps. And this features our new platform that will be going live for all of our universities over the next several months. So you'll be able to answer some questions very quickly just by clicking on any one of these areas, like where the population's vulnerable to COVID-19, whether or not the cases have peaked, which communities will require greater hospital capacity, and also some data about telemedicine. And this map goes to Philadelphia, which is where PolicyMap is located, but I can move down to Miami as well, or I can go directly to your zip code or your school zip code and move down. And you'll note, oops, did I put in the wrong zip code? I'm looking at
It's
data.
correct, 33161.
You know what? I put it in the wrong.
Oh, okay.
Sorry, that was not a very good example. I apologize for that. But here we're looking at the estimated median income by household, and then we're looking at adults diagnosed with diabetes, and the map should load. And you'll note in the new interface that you can go ahead and find this data. You should be able to hover over and find what the actual results are. You can play with the slider on the side to find areas with higher incidence and prevalence of diabetes, and where there's might be lower income, and really find those areas where this might be a problem. So underneath the COVID data, there's new data that we added on cases, deaths, cases of and deaths from, and also testing sites. And the testing site is just the state level data from the Atlantic, because that's what's available. So what you'll find is that if we can find a reliable source of this data, we're going to add it for you. If you have suggestions or questions, certainly let us know. We have info@policymap.com, or you have my email address as well if questions come up. So just know that you can do that. And this gives you a little bit of a sneak peek into the new interface. And it's really, pretty interesting because, you have more zoom levels now, and you can create more layers, up to 5 layers, and you can and or your data sets now as well. So that's pretty exciting, and you can do some things like flip your map and look at it from different perspectives, which is very interesting. So I can take this quick map off, and you can see the actual footprints of the building. So hopefully that's exciting for you. This will be something that you will be able to toggle back and forth between our legacy system and the newer platform. The newer platform should be faster, and like I said, the zoom levels will be better, and you'll be able to do some really great things. So do some exploring when it goes live for you, and let us know if you have any questions. We'll have all sorts of training available for you. But just I wanted you to be aware of this COVID-19.policymap.com app, where you can go ahead and you can find data related to these underlying health conditions. And these health conditions and risk factors are some of the data sets that I was referring to that are premium data sets. Right now they are open to everyone because they need to be. So, but they are data sets that our data team had to do extensive analysis to get the data down to the census tract and zip code level, because that's not how it is reported by the CDC. So it's our own small area estimates for specific health conditions. And then there's data in here about people who are living in close quarters, so people in correctional facilities or juvenile facilities. It pulls in data on social vulnerability, and you can break that out by the different ways that the CDC defines social vulnerability. And then, as usual, you have all those points as well. So I will let you explore that, but it's just a nice resource and something you can share widely, and not just within your university community. It's open for anyone to take a look at and take advantage of. Okay. Right here, I am in PolicyMap proper, and I am in Barry University's custom site. I wanted to, even though this isn't related to what we were looking at, just make sure that your users know that they can create their own account, and that way they can save their data and save their work, and they can upload data and save it, and they can just save it for their own use, or they can share it with a team that they might be working with, or they can always go back to it. So I just wanted to make you aware of that. And here, if we take a look, I just wanted to go through one by one with these specific data sets that I referred to. So as I mentioned, PolicyMap had created neighborhood level estimates for about a dozen different health outcomes and risk factors. So you'll note again that a lot of this is here underneath this COVID-19 menu, and you have access to this data, and you can pull it down and you can download it right now for your own use. But if you want, or this is the data that is just available to our premium subscribers. I'm sorry, I keep on messing up. 33161.
Yes.
Great. How was the weather in North Miami today? Nice?
Yes, it's I guess it's in the 80s. I have not been outside really, but I think that's where it's at.
Gotcha. So here we are, and you can see all the way down to the census tract where there's a higher number of adults ever diagnosed with COPD or emphysema or chronic bronchitis. You see this area over here in Bar Harbor where it is actually higher, and you can go ahead and pull that down and download that data or view it on a map. And you can create 3-layer maps for this data too. So here I can take a look at specific age groups. Maybe I'd want it to see where people are 65 or older. And you see everything's purple on the map. And then I can go in and take a look at these specific chronic conditions. When you go into the health status menu, there are more conditions here. So you'll see, for instance, depression, stroke, high blood pressure, and then you'll also see different risk factors like alcohol and tobacco use and obesity and overweight data. So if I go in here, I'm going to go ahead and just take a look at diabetes again. And I can use this to, take a look where this is a larger problem, where there's an older population, and we can isolate these areas. What I can also do, if maybe I just wanted to go, take a look at 5%, and maybe I wanted to take a look at social vulnerability as well, or people who are living in poverty, I can layer in, families in poverty or people in poverty. I can do that by race or ethnicity. And again, you can go in and you can, take a look and see where there's a larger number of people. So this little area up here, north of Miami Gardens Drive, 22% of the people are living in poverty. They're older, and they have been diagnosed with diabetes. And this also allows you to layer in, and you hopefully already know this, that you can layer in data about access to health care or community health care centers. So it's just another way to see what's there and see where there might be services available. And that's just a few of these data sets that are really important to our users, and know that you right now have the ability to go in and pull out this data and download it and share it with everyone on your camp who is a faculty member or student in your on your campus. Another data set is the consumer spending habits data, and this will be extremely interesting to take a look at over time. Keep in mind that you don't always have to go through the menus at the top of your screen, but you can see this is under the incomes and spending tab. And if you take a look, if I just wanted to see, what's the average annual amount spent per household on specific household expenses, or on food, or food at home, or food away from home, I can do that. I need to take off. Let's go back to our single layered map and go under here. And you'll see that these consumer spending habits are right here. So total spending, housing, food at home, food away from home. This is going to be an interesting trend to take a look at over the next couple of months and years, just to see how those trends change. So I want to take a look at food at home in this little area right here, called Highland Lakes. People are spending an average of $5,500 per year on food at home. We try and be very transparent here about how the data is collected and the methodology and where it's coming from. So you can always click on this title and take a look and see where it's coming from. And you can also always click on the source, and it's going to bring you out to our data directory again and give you information about where this data is coming from. So this data is coming from PolicyMap, but also a research firm called Quantitative Innovations. They're out of Harvard, and they're taking out the BLS Consumer Expenditure Survey and combining that with the ACS data. So keep that in mind. It's really interesting, and it will be really interesting for economists to take a look at this data in the time to come. So let me pull back here. And in addition to the consumer spending habits, there's also medical spending estimates. And if you take a look at this, this is parsed out a number of different ways as well. So there is the cost to the patient, and then there's the total payments. So if you wanted to take a look at how much is being spent on all medical care or on prescription medications, not only to just the patient, but also through Medicare, Medicaid, the insurance provider, you can take a look at that data. Again, I could take a look at this, and at this point you can go in and you can pull out that data, and when you download your data, you just choose the layer that you're looking at. You choose your location. You can choose to look at this by census tract, by county, by city, by zip code, or ZIC does. And then you can, or if you have a specific custom region that you created, you can do that as well. And you can download that data into a CSV spreadsheet. And that spreadsheet does have FIPS codes. So if you are importing it into other more sophisticated mapping tools like ArcGIS, you can bring that data into that. So there's the medical spending estimates. And then another really interesting data set is the social needs index. And this is something that was added when we added all of the opportunity zones. And social needs was a way to determine those areas that really have more of a need for help for a number of different reasons. So here on a scale of 1 to 10, and let me see if I can, oops, I did not mean to do that, pardon me. We'll go to the whole city of Miami. If we take a look at this, we can see, just to make my screen a little bit smaller, so you can see the whole screen, that the areas on a scale of 1 to 10, that the dark green are the areas of higher social need. And if I click on one of these areas on the map, it's going to tell me why. So it tells me the percent of people who are living in poverty, the homeowners who are burdened, or renters as well, people who are working age who are not in the labor force, people with less than a high school degree, and then it also takes a look at the Gini index of income inequality. So there is a group from Reinvestment Fund and from Drexel and from the Brookings Institution that wrote a whole book about taking a look at social needs and looking and mapping this with the opportunity zones and new market tax credits, so that people who were going to make investments into these areas could make informed decisions, and then the data would drive, what areas they might want to be doing investments in. So again, if I go into this 3-layer map, I can take a look at the social needs index, and I'm going to go here, pull that out. Oh, I need to remove my other ones. Sorry about that. Now, when I showed you that new interface, you know that you could actually go in and take a look at up to 5 layers. Here, I'm going to go ahead and once again pull out social needs. And I just wanted to take a look at those that were maybe 8, 9, or 10, so ranked higher on a scale of 1 to 10. And take a look at these thematic shapes And this is actually easier to do on the new interface too, but I'll show you this. Maybe we'll just look at 9, 10. And then we can take a look at these opportunity zones or those areas that you can receive new market tax credits and that are qualified opportunity zones. So again, this is those that are eligible under both programs. And we can find, for your entrepreneurs and for your business groups, those areas on a map where, there are areas of higher social need and they are designated as opportunity zones and new market tax credit eligible. If I really wanted to take a look even deeper, I could see, which are medically underserved areas and look at that on a map. And here, let me see. I want to close this up too so I can see this better. I'm going to pull off those areas that are not medically underserved. And again, I find these areas just north of the Airport Expressway. That is a medically underserved population. They're eligible for new market tax credits and opportunity zones, and there's a high area of social needs. So just really interesting. And the social needs index is, again, out of that urban research firm, New Localism Advisors, and gives you some really interesting information. Really important, I would think, for social work or anybody in the healthcare who's studying health sciences and behavioral risk factors related to health. So the final piece I'd wanted to show you is that we have a healthcare report. And I'm not sure if anybody ever sent you a sample healthcare report. The healthcare report pulls out all of these underlying areas and conditions within that area, and it is available on the census tract and county level. So if I click on Get Report, you'll note here on your interface, it's grayed out. This is a really thorough and up-to-date report that pulls in all of the underlying data and creates a multi-page dynamic report for you. So I'm going to go in and I'll go to my own PolicyMap account and show you this. And I'll send you a sample report.
Okay.
Merlene, do you vote for a county report or for a census tract report?
Let's do a county report.
Okay, and are you Dade County? Is it Miami-Dade?
Miami-Dade, yes.
Okay. Oh, I don't want to do a community profile. I want to do, here we go, Miami-Dade. And when I generate this report, it's going to very quickly pull down all that data that you can view directly on the map, but pull it into a report that shows you really timely information about what's happening. So you can link down to different areas of the report from directly within here. But within this report, you'll see information on population and population trends and the growth over time from the year 2000, information about the largest age groups. So about 16% or a little bit over 15%, 15.5% are 65 or older. You can find data about the predominant racial and ethnic groups and the percentage of the population that is Hispanic or Latino. You have data here about access to healthcare. So the rate of dentists and primary care physicians, all of these reports and this data can be downloaded from within this report. And then also data about the facilities that are there. So if I needed to get a spreadsheet or a table of all the mental health facilities or drug and alcohol treatment facilities, I can pull that out from directly within here. And these are the information bubbles that you look at when you see your data points on a map on PolicyMap. But you can pull it down, lots of really specific data for these points as well. There's data in here about access to healthcare insurance and those medically underserved areas that we were looking at before. Again, you can download the images or the data from within the report. And it's going to show you, the different census tracts that are considered medically underserved. And you can pull that down again. Data about disease screening and prevention and health behaviors, and how Miami-Dade County measures up versus the entire state of Florida. So we have data about smoking and drinking and obesity rates, physical activity, mental health or perceived mental health status, and disabilities. So 1 in 10 people within the county has a disability. And then there's data about those chronic conditions. So this is that premium data again, where you can see data about high blood pressure, high cholesterol. So this is also a great ready reference if you need, just this data about the rates of specific diseases within your county or within a census tract or zip code.
I have a question, Beth. I
Yes.
noticed with that information for the United States to compare it with, it's not available. Because I see Miami-Dade County, Florida, but the United States. Is that the norm, that it's just between the county and the
You know what?
state?
That's a good question, because if we go into let's go back to regular PolicyMap after I show you this, and we'll see. They should show you the rate for the entire country, but I'm going to take a look.
Okay.
Okay, so here's the cancer data, and then data on HIV and sexually transmitted diseases, mortality rates, injury-related mortality, drug overdose deaths. We often say that PolicyMap does have a lot of depressing data, but truly it is data that informs policy and helps others to find areas of concern or where we can be helpful. There's data about food insecurity, and here's a map of farmers markets and SNAP retail locations. Again, you can pull that out and see, where the list of all of the SNAP retail locations in Miami-Dade County. Food stamp information, again, limited supermarket access, and then all of those social determinants of health. So data on crime from the FBI Uniform Crime Reports, data on educational attainment from the census, data on income levels and the stress that's involved if people are living in poverty. You can see, people in poverty by age and race, unemployment data. And this data is updated monthly. Right now we have March. That's really going to be shocking to see soon. Data on specific industry sectors. So, people that we need to be concerned about, people who are employed within the retail industry or people who are in food services, in healthcare. So really important data right now. And then housing data, homeowners and renters, subsidized housing, cost burdens. Really, really interesting. And access to transportation. So that's the healthcare report. I will save this and send it to you so that you can have it as a reference, and you can see exactly what's included within that. But if we go back to, actually, I'm going to print that out, and here I want to print, actually. I think PolicyMap's going to be mad at me for asking them to do too many things at once. Okay, I'm not going to save it here. I'll just save it. I'll send it to you later.
Okay, thank you.
Okay, so let's go back to the map. And we are looking at, and let's go into the new policy map so we can take a look at it there. So you can get another peek. And you'll notice how you can go back and forth, and that will be the case with you. If I just type in, if I wanted to take off this, I can go in and we'll take a look at, let's take a look at asthma. And it's going to show me, I can take a look at this. I just want a single layer map. I'm sorry, this will be better. And for this, let's go to I'm in Salt Lake City. Let's go to Miami. And if I zoom out a little bit, I can find those areas, and I can choose just to look at where it's, and this is the new, I really love this about the new version, where you can just take a look at different cut points and eliminate ones you're not interested in from here. And I can click this. It's going to show me, right now it just shows me Florida, county, zip code, census tract. But I wonder if we just do the entire United States, if it's going to show me. And so if I take a look at national, I feel like the way that it's parsed out, it's not going to show me that at the national level.
Okay.
Okay. And I'll ask our data team about that, because that's an excellent question. It's always interesting to look at this data too at a national level, especially now that you can cut, out. And if you just wanted to take a look at ones that are higher, and you can always play with these, with the data as well, and change the variable. This is %, but I can take a look at numbers, and again, I can change my cut points or ranges from here. So if I just want it purple to be a specific range, I can, play with this a little bit more. That's the wrong one. So it's pretty interesting. And I'll find out about, that's a really good question, Merlene. Okay. So take a look at just the county, and again, you can see. And from here, you'll be able to download the data and get the reports. Okay. And we can always look at trends over time too, if the data is available for trends over time. And that's not the case for the healthcare data because of the changing boundaries. And we just added the most current data here for that. So that, in a nutshell, is some of the data that I wanted to highlight for you, which you have access to right now, except with the exception of the healthcare report. But I will forward that to you, and you can share it.
Okay. I have a question regarding the layers that we can collect data for. Is the premium the one that has 5 layers? Because I think we have 3 layers. We can do up to 3 layers, or the 5 layers are currently available to us?
Right now, everyone who has an enterprise site through Legacy PolicyMap has access to 3 layers. And once we transition, all of those sites will be able to create up to 5 layers, and that is not premium. That's a feature that is available to all users. We're just in the process. It's in beta right now because it is a brand new platform, but you will have access to all of the data layers.
Okay, thank you for that clarification.
Sure. Well, good. That's a bit of an overview, and I'm happy to answer any other questions that you have too.
Phil, do you have any questions, or Francis?
I can check the chat. I've just realized that I wasn't looking at the chat menu at all.
Okay.
Let me see.
Okay, Francis, no.
I'm very impressed with all those features. Yeah, it's going to be quite useful. I happen to be the librarian for business, and this is going to be very useful for the business professors and students.
Oh, good. Well, wonderful. And if anything comes up, just let us know. We're happy to help you and answer questions. But we're just trying to put data out there that's really important. So.
Okay.
Great.
All right. Well, thank you very much.
Oh, thank you. And stay safe. And we hope to hear from you.
Okay, you too. Take care.
Thanks.
Bye-bye.
Have a great day. Take care.
Thanks.
Bye-bye.